Being able to successfully treat an infection is incredibly gratifying, and it's what keeps me coming back to work every day. I'm lucky because in infectious diseases we still have a lot of curable illnesses, and so that's really fun to be able to cure a patient. I started treating HIV back in the late 1980s when we had just one pill, AZT. And now, I've got a menu of 25 different pills to choose from. Hepatitis C is another example. Just in the past year, there have been tremendous advances, and this went from being an untreatable disease, that's the way I was taught back in medical school, to now being a disease that's curable. That's remarkable. I'm married. I have 5 children. 2 of them are adopted from Ethiopia, and I met them when I was working in Ethiopia when I initially fell in love with infectious diseases. I came to understand the tremendous impact that infectious diseases have on much of the world's population, and it was like one of the most gratifying experiences I ever had. When I came back, I sort of switched my focus from primary care to infectious diseases, and then I went back and worked in Africa for another couple of years as part of my fellowship with the University of Washington, at that time doing research on HIV infection in women and trying to positively impact the HIV epidemic. That was in 1998. And that's where I met my 2 children, and then ended up coming back here to practice. Well, I think compassion is being able to put yourself in the patient's shoes. The key step really is listening, because if you don't listen, you don't hear what it's like to be that particular patient. That's actually the best part of the job, I think, is finding out about the story. Often patients are acutely ill, and sometimes it can be sort of the worst time they've ever had in their lives. And so we're there for that, and we get to witness, the bravery and the dignity of some of our patients, and that's great. Even though I've been doing this for so long, I'm still amazed by the grace that some patients have when they come through these really difficult periods in their lives.